But in the operation channel, okay. Ready? I am on. Okay, it's like.
Okay, this young girl is an operated case of unilateral complete cleft lip and palate. If you see the scar, she had a left-sided cleft lip. So she presented to us with a complaint of a severely retrusive maxilla, that is hyperplastic maxilla. She has an negative OHZ of nearly a centimeter. We are planning for AMD, that anterior maxillary osteotomy and distraction. If you see that's patient-specific distractor device, it's a Hyrax distractor which is present inside. So we'll be doing anterior maxillary osteotomy and bringing the anterior maxilla forward to match, to increase the projection of maxilla so that facial balance proportions are balanced. So it's going to be a anterior maxillary distraction surgery. Thank you.
Sure.
Before and after of a patient on whom we've done upper jaw distraction osteogenesis. It's a type of treatment when patient has severe growth issues. You insert a patient specific device, in this case it's tooth bone, and then we turn and bring the jaws forward, and after a few weeks, lo and behold, there is new bone there. And this is the immediate result. Sorry for the shadow on the pre-op picture, but this is her on the table. This is the recent view, that's the current view. Okay. Kadichamale? What to call Perlin? Remove the splint. Not splint.
Device AMD.
You have to make another one. Re-AMD. Clear aya? No kate. Oh, okay. Kadicho. Madi. Pua. Idu mumbata. നമ്മൾ സർജറി ചെയ്യാൻ മുമ്പത്തെ എത്ര വ്യത്യാസം കണ്ട ഫേസ് ഇങ്ങനെ ഉണ്ടായി, ഇപ്പം ഇങ്ങനെയായി, നോർമലായി. കീഴ്ത്താട മുകളിൽ കുറച്ച് സ്ട്രോങ് ഉണ്ട്, നിങ്ങൾക്കെല്ലാം കണ്ട ഇങ്ങനെ ഉണ്ട്. ഇത് ഇവർക്ക് പോലായി താട. അപ്പോൾ അത് വേണമെങ്കിൽ പിന്നെ നമുക്ക് ചെയ്യാം, അതിപ്പം ആവശ്യമില്ല. So what you're seeing here is a before and after distraction osteogenesis. And you can see we've used a tooth bone patient specific device and changed the entire upper third face. We haven't done anything to the lower jaw, but you see this lower jaw looks way too long, and now it looks proportional. But nothing has been done on the lower jaw. We worked only on the upper jaw and on the high LIFO level, and you can see the changes that has happened. And this has taken about 2 weeks for her. So we've done the upper jaw distraction on this side for her, and there you can see the device, and the gap that you see between the teeth, that's the new bone that we've grown. That's about 2.5 centimeters for her. Good job. Next, we will get her teeth done, and then she'll have a nice profile. And if she desires, we can then augment the nose as well, and maybe a little bit on the chin because this is a little bit strong. But the jawline, it's all beautiful. So you can see that huge change, life-changing change. And we've not cut the jaw and brought it forward. We've created new bone. And that's how she should have been in the first place itself. And it's just finished yesterday. I'm going to show you the front view too. That's how she was. Do you have any more pictures? I think we have another picture here. But this is really the real picture here. Huge improvement. Right.